Hi everyone, I'm Dr. Faisel Sayed.
And I'm Dr. Dan McCarter.
And you're listening to Faisel and Friends, where we believe access to primary care is a right, not a privilege.
Faisel and Friends is brought to you by Primary Care for America, a diverse collaboration of innovators leading the way towards comprehensive, continuous, and coordinated primary care. Today, we're sharing two different conversations about teaching tomorrow's family doctors, residency, resilience, and new models of care. First up, we're talking with Dr. Makandall St. Eloi. Let's get started.
Here we've got our next guest over here, Dr. Makandall St. Eloi, former colleague, good friend. Welcome.
Thank you guys for having me.
Sure. So just for the audience, can you tell us a little bit about what your title is and who you work for?
All right, so my name is Makandall St. Eloi, MD. I currently work at Chen Medical. I'm the senior medical director there. I've been there for about 5 years now.
Wonderful. And now you're here at the national conference.
Yes.
You're meeting all the students, and you're working in a model that doesn't do billing.
So, I initially started in the fee-for-service model, which is much different than what I do now, right? So I was given the opportunity to get to this value-based care system, but nobody really knows much about it, right? When you get to residency, you're inundated with rotations and you're in the hospital service and all the specialists, and you never really get an opportunity to figure out that there's something different, right? And I was open to the value-based care model and say, hey, why not? Since I've started, it's been such a pleasure, right? I think you never really get to experience hand-holding patients through everything, from the beginning to the end, whether it's hypertension or to the difficult discussions of like end of life and palliative, but you're right there, right? Connecting them with specialists. Sometimes you're seeing them every day, every other week. Just such a beautiful experience to not have to worry about sending to a specialist because you're well trained and that you can navigate all the experiences for yourself.
And now I know you have put some rotations together for learners, correct?
Yes. So very thankful that the company was very open to me exploring those options. Right now we have a practice management rotation with the University of Miami. Great experience, right? So they come in not really knowing much about value-based care, but now coming in and then getting to know what's Part A, what's Part B, what's Part D, right? All these nuances of medicine and really get to challenge themselves to see something much different than where they practice.
So these are family medicine residents?
Yes, these are family residents.
So what led you to an interest in education? Because a lot of people go their entire career practicing and don't ever work on teaching the next generation. Where did that passion and education come from for you?
Well, I think, for being very fortunate to become chief resident at University of Miami, that really sparked a leadership opportunity because you're always teaching, right? PGY1s, PGY2s, and even your colleagues, PGY3s, right? Once you step into that chief role, everybody looks at you different. You're not an attending, you're not a resident, you're just in between, right? You're the quasi-leadership. And since then, it's been a bug, right? And I think being able to have an influence to change, and that really what sparks education for me.
So as you're meeting the students here this year and futures here at the national conference, what are some of the stories that you're hearing from the students and the residents who are coming by the booth and asking about what you do on a day-to-day basis?
The biggest thing is just what is value-based care, right? You'll be surprised that most people really don't know. I just think that the way our programs are really set up right now, it's really built towards the fee-for-service model, right? And I think there is another way. And I think there's an opportunity to really expand the knowledge and expand what we can do, expand the education, and then open them up to something that's really more aligned with where you're practicing. Right? Family medicine has a strong culture of being prideful in what they do, how they're educated, being able to handle any type of disease complexities from heart failure to kidney disease to any of the multiple comorbidities. And family medicine really prides themselves in really trying to navigate patients through that. It's kind of what we do.
If you had one student that you could sit down with and encourage them with steps that they can take today to find a fulfilling career, what would that be?
First of all, take time for yourself, right? You have to take time for yourself, knowing what you do want. Are you focused on being a family person? Are you focused on, leadership and professional development? Go to a company that's really going to invest in you in one of these aspects, or maybe both, right? Because we work so hard and so many years of education. It would be a shame to go to a company that doesn't back what you find your core values are.
I ran into a resident this morning leaving the hotel, and she said, she's a third-year resident, and she said, do you remember what it was like when you finally got to the point where you understood pathophysiology, and you worked so hard to get to that point that it doesn't matter what the medicine is or what the treatment is, you can, in your mind, make sense of the physiology going on, right? And she's like, I spent my whole academic career to get to this moment, and now I'm here like, oh my God, this is just the first step. We got to start connecting the dots now with all the social reasons that people end up getting sick. And so that kind of energy is not something that we see when we're out in our day-to-day world.
Yeah.
So for these students who are making that transition, what advice do you have for them?
The biggest thing is that your energy and interest is infectious. Go for whatever really grabs your interest, right? And then go all the way. Don't stop. Follow all the navigations and pathways to whatever really piques your interest, because the end goal is really such an amazing career in medicine, whether it takes you through professional development and administration, or you just become like a large community leader that impacts a community that's never been seen before.
Right, and I mean, what you're talking about is always be curious, always be learning.
Yes.
And if you go down a path, learn what you can there, and then if you decide you want to do something else, you still have the opportunity to do that as well. I mean, I didn't know you when you were doing fee-for-service. My guess is you were a stellar doctor when you were doing fee-for-service as well.
Thank you.
So I understand why you want to be part of value-based care, but I really applaud you for wanting to make a difference in learners too, because you don't get paid extra for taking medical students and residents into your practice, but it is a very important work, and I think that a lot of the people who do that work in family medicine particularly are sort of the unsung heroes that are giving those experiences for the future doctors to open their eyes to what all the opportunities are.
Yeah, I think the impact is the payment, right? The impact that they make on the community and the difference that they make, that's payment enough.
Oh my gosh. Well, hey, thank you, Makandall. Thank you so much
Always,
for taking the time.
No,
Poor guy was minding his own business. And
Thank you, guys.
To continue the discussion, next we're talking with Dr. Christian Widder and Dr. Farah Shaukat.
So here we have our next two guests. We have two residents over here with us from Wisconsin. So I'd love for you both to introduce yourselves.
Sure, my name is Farah Shaukat. I am PGY3 from a Lake Geneva, Wisconsin program. I'm also one of the resident delegates of WAFP, and today I'm representing my program and also the WAFP chapter.
Wonderful. Welcome.
Hi, I'm Christian Widder. I'm a PGY2 at the Fox Valley Appleton Family Medicine Residency. I am a resident director on the WAFP board as well, so I'm the alternate delegate. So I'm also representing the WAFP and my program as well.
Wonderful. It's great to have you both over here. So let me ask you to start off with, how long have you been coming to National Conference?
So this is my second time coming here. Last year I came here as an alternate delegate, and this year I was fortunate enough to come as a delegate. Definitely, as you can see, the energy is very infectious, and that was the reason when WAFP offered me to come here, I was like, definitely I will be there to give the energy and take the energy back.
And this is actually my first time here.
Wonderful.
Yeah.
And how's it been meeting all the students and meeting doctors and students and residents from around the country all in one place?
It's a lot, but it's very exciting. I think it's really nice seeing like fresh faces, seeing the enthusiasm between students, residents who come represent their programs, faculty who come represent their programs and give talks. I mean, Dr. Marcy Faustin, who gave the keynote talk yesterday, was amazing, very inspiring.
Well, yes, we see with you just being a PGY2 and you being a PGY3, you couldn't be further worlds apart. How has the transition been going from an intern to now being a PGY2?
It's been a journey. I think the first year went by really fast, and I started off on a rotation the second year, where I was a senior on a rotation, and I think that just boosted my confidence, honestly, and just helped kind of solidify things that I learned during my intern year. So I personally thought it was a really nice way to start the second year.
I mean, all of us are forever students, and all of us are forever residents. And as you said that you were a PGY2, I immediately remembered what the transition felt like in July from being an intern to being a PGY2. And then now with you being a PGY3, what's that experience been like?
Well, it's wonderful to see how far I have come across. Like, firstly, I'm a part of my inaugural class of a new residency program. So knowing that I'll be the first PGY3 graduating, that's pretty, inspirational to me, that I've led really good stepping stones for my future younger residents. I remember when I started the program, I had no clue how the program is going to run and what family medicine is going to be like. But I feel when I came here as a second year, that was like an eye-opening experience for me when I was able to interact with different PGY2s, PGY3s, and see where PGY3 end up going. Like, some ended up being hospitalists, some ended up doing outpatient, some ended up doing research. So right now I feel like I'm at the transition point where I'm trying to make those big decisions, where I can incorporate all the different and the unique aspects of family medicine and provide the best care to my patients.
You know, I've been reading about all these programs every year. Like, I'm excited with more family medicine residency programs opening up. I'd love to hear a little bit more about your experience in an inaugural program. What was that like? You know, we're seeing different types of residency training experiences. Like, they have these community-based residency programs, which are so exciting. They have the traditional, of course, the hospital-based residency training programs that are established. But now we've got these new residency programs that are opening up. What was that like going in and actually being a trailblazer? I remember one of the things that stuck out with me is you being such a, like, hey, let's make the way for everyone else.
I totally agree, because this was exactly the right term that was used for me during my residency interview season, that we need trailblazers for this residency. So it was challenging, but it has its own good and bad moments. I wouldn't say bad, but I would say more learning experiences. One of my challenging experiences was definitely learning how to navigate the system, Mercy healthcare system, knowing who to contact, when to contact, then trying to arrange the schedules for the patients, trying to arrange schedules for the future residents. Those were some little challenges, but I feel like with a good co-worker and with the supportive program director and team, we were all able to overcome this thing. I feel one of the things why I chose to be a part of the inaugural class was because I really wanted to be a part of a founding class, in the way that I can set some good, remarkable steps for my future residents. Because I know medicine can be very tedious at times by just studying and seeing patients.
Yeah.
And by being a part of an inaugural class, I wanted to give my program other innovative ideas of how that can be incorporated into medicine. Because I feel medicine is no longer the same as it was 20 years back. I'm a big proponent of research, and my passion has always been cancer prevention. So that was one of the things that I was able to introduce at my program, like establish a mobile health clinic in my Walworth County. So we're in the process of establishing that and doing a lot of open outreach experiences. And I feel these were the flexibilities by doing activities out of the box was what my new program allowed me to do, and I'm really grateful for that.
If you had one thing that you could tell one of the new interns who just started, like, oh my gosh, you have no idea how good you have it compared to when I was an intern, because this is going to happen for you for the rest of your life.
Yeah.
10 years from now, 20 years from now, you're going to say, well, when I was an intern. So now you've got this program, it's up and running, you've got these new students who are just starting their residency careers. What's the one thing that you could tell them, hey, if you think that this is rough, you know, you have no idea what I had when I was an intern? I
feel like residency is a very personalized journey. Yeah. So I feel like it's going to be different for everybody. My role and my program's role as inaugural class was to give them the basics. residency is always going to be what they make out of it. So I strongly always tell my interns that, hey, have an open mind, have the thirst of learning, and just craft the path that you want to craft within the guidelines given by the AFP and the ACGMEs. The most important things.
So Christian, you're a second-year resident, and so what is the most interesting or inspirational challenge you've had to overcome as a resident? You were talking about being a senior resident on service, and I remember some of my challenges as a supervising resident back in the day. So just wondering what has excited you so far that might have looked pretty daunting on the one side, but on the other side, you're like, I'm really glad I was able to do that.
Yeah. So I started off this second year on the inpatient medicine service, where I was a senior. It's only an intern and a PGY2 on the service with the attending, and it was amazing to see the amount of learning and capability that I was able to perform, and the growth that I was able to see in myself. As an intern, the expectations are pretty low. I mean, they start you off maybe seeing 4 patients, kind of depending on your capabilities and your comfortability. And there can be, up to 16 patients at a time on the service. And the amount of knowledge and balancing that you can do as a senior was really amazing to see. I felt comfortable being able to see everyone. I mean, as a senior, you're supposed to kind of know everyone on the list, be able to communicate well with your intern at the same time, and make sure to keep the service afloat. And sometimes even directing attendings, even if they get a little, askew at times. So just being able to have that sort of supervisory role, but also making sure that everything's afloat. That was really amazing to see.
Yeah, no, that reminds me of when I was a resident, and there were certain attendings who would tend to just ramble and pontificate about things. Unfortunately, I'm afraid I've turned into one of those attendants. but they would have, you'd have to move them along. It's like, well, I've got 3 more patients to see. We need to move things along.
Exactly.
Yeah, that's great.
It's one of my favorite things about family medicine is that once you get into this path, we're always students.
Yes,
We're
lifelong
always
learners.
interns. We're always like you said, like a lifelong.
Lifelong
We're
learner.
always curious.
Yeah.
Because you can't. We were talking with a doctor earlier, and she's like, I can't practice medicine the way that we did 20 years ago. There'd be malpractice situations,
Exactly.
right? So it's one of those lines of work where you have to stay up to date.
Yep.
And but apart from the clinical side, the experience has changed for family medicine just in the last year.
Yeah.
With all the tools. So I'd love for you to share with how all these new AI innovations have changed the residency experience. I mean, in 1 year.
Exactly.
I mean, it's amazing where we were a year ago to where expectations are now for what it should be like as a doctor.
Yeah.
I strongly echo with what you are saying, that medicine and healthcare in general, with AI and technology, they are moving really fast. And at times it's very difficult to keep up with that. I know one of our preceptors, Dr. David Augustine. He's an amazing holistic family medicine preceptor. He actually was the one who actually encouraged and introduced us to different AI platforms like OpenAI or Curious. And he is always like, whenever we are precepting with him in outpatient clinic, he's always going to be telling us, hey, okay, let's put these symptoms in XYZ AVA and see what else are the potential differentials we can come up with. And I feel like that's kind of a good thing because it helps us think out of the box. Because even I think one of my struggles, and I feel most of the struggles of residents, is like trying to cope up with learning and doing clinical care. And when you can do learning along clinical care together, that makes learning more easy. So I feel that's one of the biggest advantages over the years. In these 2 years, I felt by incorporating the AI tools that at least I'm able to keep up with medicine. Like if I have a patient with back pain and joint pain, and if I just add that thing, I'll get like 10 main differentials with it. Okay, I was like, okay, this is what I need to know about this patient. So it will keep me most up to date rather than going and reading the whole paragraph on back pain and joint pains. So I really enjoy using AI.
Raises the importance of being able to talk to the patient
Yes.
and getting the history, asking the right questions, because there's an old saying in computer world, garbage in, garbage out. So you've got to ask the right questions
Yeah.
if you're going to get good answers.
Yep.
And so figuring out how to, what's the term I've heard people use now? Prompt engineering.
Prompt engineering.
How to use the right prompt to
Yeah.
get the answer that will allow you to provide the patient the best possible care.
Yep.
So I'm wondering, over my career, I saw computers first used to document patient care, saw the internet come into being. During COVID, we certainly saw AI, having all the online, even I can remember used to moonlight in an emergency room, and I would carry my Merck manual with me because you didn't have access to knowing how to do anything, and I was by myself in this rural emergency room. So I wanted one book that had something in there. What do you all see happening in the next 10 to 20 years if you were dreaming as to where we are now? Because this will be your time. You're the future. This is your time. What do you see happening over the first half of your career?
That's a great question, and it's really interesting because to an extent, I feel like it's a little hard to tell, especially now, because I still feel like AI is, especially incorporating into the medical world, is still pretty new, and still, people have their hesitance. But like one of our recent graduates, Dr. David Cupp, he was an advocate for AI, especially in the healthcare world. He previously worked for Epic before coming to medical school and residency. So he really taught us what the benefits are of AI, how it can be used and well incorporated. One of those things being, helping us write our notes, especially in the outpatient world. But then also using tools like Open Evidence AI to kind of just help succinctly and rapidly come to a resource. And I feel like that is a great way of using AI in our practice. But I think it's also important to stress to keep up with everything too. Hey, use that in the meantime, but then maybe later on take a moment to kind of, read more in depth into certain aspects. And I feel like that's kind of the push that I probably see going forward.
Right.
And I'll just piggyback, Christian, on the documentation part, that as primary care physician, we see a lot of documentation in outpatient, and I feel like AI can really help us with that documentation part. And the time that we spend in doing documentation, that time can be compensated or it can be replaced by spending more time with the patients. Because I feel that's very important. I've seen, like, doing my residency in a rural community, I feel when patients come to me, they want to be heard and seen, not just seen, And I feel one of the ways where we can hear them is by giving our full attention to them. I've seen practices in which, physicians will be on their computer and the patients will be there, and patients will be like, hey, you didn't even give me 5 minutes, But I was like, and then that's, I feel, not good practice, medicine practice. I feel as a family medicine practitioners and future of healthcare, we should really take the patients as a whole, and we should see them and hear them both. And I feel AI will really, really help us doing that.
Wow. Well, listen, both of you, thank you so much for taking the time. I just happened to run into you this
Yes.
morning, and here we are recording a great conversation.
ChenMed just connected us.
There you go.
Because I remember a few years back, I was just trying to find good family medicine mentors who practice holistic medicine, and that's how I bumped into your profile and to your clinic profile. And now I'm luckily that I bumped into you and we got a chance to exchange more ideas.
I tell you what, I still can't believe it that we're recording these conversations. We don't understand. We just we enjoy talking with people, and we love sharing firsthand accounts of what's really happening on the ground.
I agree.
Because otherwise we're getting our information from somebody else why get it from somebody else when we have so many of us? And the wonderful thing I feel whenever we come to these conferences is how similar our energy is.
Yes.
You know, we may have different goals and focuses, but the overall energy of just wanting to help people.
Yes.
This is what it's all about.
I
and
agree.
so I am grateful that we ended up starting it. I cannot believe that it's still happening.
Thank you so much for having us. I really appreciate both of your time.
Thank you both.
Thank you so much. This was amazing.
Thank you so much.
What are your thoughts on teaching tomorrow's family doctors? Residency, resilience, and new models of care. You've heard ours. Now we want to hear yours.
Email us at faiselandfriends@gmail.com, and your question could be featured on the podcast.
If you like this episode, leave us a review and tell us how we're doing. And don't forget to subscribe wherever you listen to podcasts so you never miss an episode.
Connect with us on social media by following Faisel and Friends.
And follow Primary Care for America on LinkedIn and Twitter.
I'm Dr. Faisel.
And I'm Dr. Dan.
And thanks for listening. This podcast is brought to you by Primary Care for America Collaborative and produced by Split Prism Productions.